Good evening. Can you hear me?
Yes.
Yes.
Awesome. Good evening, everyone, and Happy New Year.
Happy New Year.
Welcome to the first Board of Health meeting in 2021. Can you hear me all?
Yes.
Yes.
Am I loud
Yes.
enough?
Yes.
Thank you. A nice reminder to everyone to please turn off your cell phone and mute your devices so as to prevent distractions. Okay, I see. Who is this person? Can you please identify yourself, introduce yourself as members of the board?
IRS. And he could like leave the.
Dr. Dean.
Hello, Dr. Dean.
Hey, Doc.
He would also like.
Dr. Asadi, how are you?
Was carrying the.
Hi, Stacy Cox,
Hello, Ms.
General
Scott.
Representative.
Hello. I see Dr. Dean. Any member of the board?
Did you hear me? Stacy Cox.
Sorry. Yes, ma'am, I see you.
Okay.
How are you?
I'm very well, thank you.
Okay.
In the room, you have Kelly Smith and
Okay.
and Jennifer Green.
Okay.
And also from the health department, Dr. Hagler, Lori Hagler, medical director, and Candy York, accountant. And I can't see that far across the screen.
Okay. Anyone else in the meeting? I see Ms.
Good
Curtis as
Dwayne Holder has joined.
How are you, sir?
Fine, thank you.
Good. Anyone else?
Hi, this is Ashley Curtis, Deputy Health Director.
How are you? Dr. Markman said she will not be present because she has another meeting to attend to. Okay. So I will start the meeting by saying thank you for taking time out of your busy schedule to attend the meeting. Can we take a minute silence, please, to unwind and bring awareness to the present? Thank you. At this point, is there any other person that I may call upon to briefly introduce yourself?
Hi, this is Mr. Larch.
Hi, Mr. Latch, how are you?
Good, how are you?
Wonderful. Anyone else?
Yes, I'm Dr. Tandika Burks.
Dr. Box, how are you?
I'm good. How are you?
Fine, thank you.
Great.
Okay, we'll start with the meeting. Please take a look at the agenda for today. May I have the first motion to approve the agenda, please?
Make a motion to approve.
Second,
Second.
all in favor?
Aye.
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 Thank you. I believe that we also had the opportunity to go through the meeting minutes from the December 15, 2020 on pages 2 to 5. Anybody have any comments?
Hello? Hello?
Hello, can you hear us?
This is Tanya.
Hello, Ms. Tanya. Welcome on board. Thank you. Anybody have any comment on the minutes meeting from last month? Do I have a motion to approve, please?
I'll make a motion to approve.
I have read it, and I make a motion
Second,
to approve the minutes.
all in favor?
Aye.
Aye.
Thank you. At this point in time, I'll call on Mrs. Candy York to please present the bad debt write-off. Mrs. Candy York?
Thank you. Yes, ma'am. Good evening. Thank you.
Good
On
evening.
page 6 in your packet, you have bad debt write-off number 62. As of September 30th, 2020, the debt stated above on the patient accounts were 90 days or older. We're requesting to submit these patient accounts to the debt set write-off program for North Carolina. Any patient that has a balance of $50 will be sent to the debt set-off program, and we will recoup funds from their tax returns and also lottery winnings. And I'll be happy to answer any questions in regards to this request.
Any questions, comments? I have a question, Ms. York.
Okay.
See, this was dated December 1, 2020. Why was it not presented last month at the last meeting?
Yeah. Well, we have to, after the bad debt write-off, 9/30/2020, and then we try to collect these. And so we have them set on the agenda on certain months throughout the calendar year. And so we always present these. They try to still collect on these after September all the way through December. So October, November, and December for another 90 days. And then we actually present it to the board in January.
Okay, thank you. Any more comments?
You're welcome.
May I please have the motion to approve?
I make a motion we approve.
Thank you. Second?
I second the motion.
I second.
Thank you. All in favor?
Aye.
Aye.
Thank you. Let's move on to item number 3 on the agenda, please. The floor is open for public comments. Please.
There is no speakers registered for public comment.
Thank you. In that case, we'll close the floor for comment. Ms. Candy York, can you please come up again and present the financial reports?
Yes, ma'am. Beginning on page 7 of your packet, you have the statement of revenues and expenditures for the month closing December 31st, 2020. At the close of the month, our revenues exceeded our expenditures by $223,987.56. On page 8 is a listing of expenditures by revenue, also as of December 31st, 2020. We have expended 40.41% of our budget. Of course, if we'd expended 100%, we would have been at 50%. And as we state generally in each month, it's due to lapsed salary and also the timing of certain expenses. The reason why we're not, of course, spending at 100%, which obviously at this time of the year is 50%. I'll answer any questions you have as we go along. Just let me know. On page 9 is your revenue listed by source. On page 9 is your state and federal allocations and also the grants and the amount that we have collected so far through December 31st, 2020. On page 10 is a listing of our Medicaid earnings at the top, followed by the fees. And then on page 11 is a listing of the fund balance that has been appropriated and expended so far, and then also the county funds that have been allocated to the health department through December 31st, 2020. On page 12, an accounts receivable report, also as of December 31st, 2020, listing by program and then by payer source. And then lastly is the agent report for the self-pay payments. And that is listed by the program and then the aging. And I can try to answer any questions you may have about any of those.
Any comments? Questions? Thank you, Mrs. York.
Thank you, ma'am.
You're welcome. Next item, Dr. Thandika Box, can you please give us the annual Stedman-Wade report?
Yes. Good evening, everyone. For those of you who don't know me, I introduced myself earlier. I am Thandika Burks. I am the family doctor that is in the adult health clinic. I bring you greetings from Stedman-Wade this evening on behalf of our CEO, Mrs. Margaret Covington, and my medical director, Dr. Sandra Carr Johnson. They couldn't be here tonight because we have our board meeting at the same day and time as the Board of Health. I just wanted to quickly say some thank yous. First to the Board of Health, because this is our first time presenting, but we want to thank the Board of Health for partnering with us because we basically share the same mission to serve the patients in the county who are, especially the ones who are underserved. That's the heart of our mission, to provide comprehensive primary health care and preventive health care services for them. So we want to say thank you for partnering with us because it makes our job easy. We know that people reach out to the health department when they're in need, and so we are happy to be here to help provide those services. We also want to thank Dr. Green and her staff at the health department for sharing their space, their expertise, their services, and especially the hospitality while we're there. We have a lot of fun in the adult health clinic, and we're happy to be there. And two, thanks to Dr. Green and her staff, during this time in the pandemic, they've done an exceptional job with the testing and the tracing and now the vaccinations. And so just from Stedman-Wade, we want to say thank you for all the hard work you're doing for the citizens and our patients. Can I ask someone to go to the next slide, please? Please. All right, thank you. So this slide just basically lists some of the services that we offer at Stedman-Wade Health Service across the spectrum of our organization for those of you who may not be familiar. Next slide. This is just a slide to show you some of the PI and QI work we've been doing with the adult health clinic. We were JCO accredited last year. Wade has been already accredited, but the adult health clinic itself was accredited in 2020. Just today, we received our certificate for being a patient-centered medical home. And so that's something we're happy about. And also, we just recently had a HRSA survey where we received a lot of quality awards, and we're happy about that. And we just wanted to kind of share that information with you so you could know that, we're serious about the work that we're doing in the adult health clinic and give you an idea of the quality of work that we're doing. Next slide. Okay, so down to the real business, I guess. This slide shows the total encounters and the unduplicated patients that we saw in 2019 and 2020. To the left of the slide here is kind of just some details about the encounters and the scheduling. We see on average about 75 to 80 patients a week. We're about 3 to 4 weeks out for our new patient appointment wait time, that's probably been about the same for the past year or so. We do have same-day new patient slots, and also we reserve slots for in-house referrals. Next slide. We included this slide just to kind of give you some information about the no-shows and the canceled appointments. No-show appointments have been somewhat of a challenge for us in the adult health clinic. Well, and actually we've tried different types of scheduling situations to try to make it better. However, since the pandemic, we've been doing telehealth medicine, and the patients have seemed to respond very well to that. So going forward, we were thinking that we're going to do a hybrid type schedule where we have face-to-face as well as telehealth appointments, just to see if we can capture those patients who don't normally show up physically for their appointments. Next slide. This slide shows the insurance payer mix, and as you can see, most of our patients are uninsured, and basically those are the patients that we seek to serve. So we're actually, happy about that. All right, next slide. The rest of the slides really are reports about the performance measures and targets that are set by the health department. Here, diabetics, the target value is for diabetics, 75% of the diabetics to have an A1C below 9%. In 2019 and 2020, we actually succeeded those goals. Next slide. The next slide is about our hypertensive patients. A little bit over half of our patients, hypertensive patients, are controlled. We did not meet the target goals. It's below the target goal set for us of 85%. Mainly, we think it may be due to like the social and economic factors that the patient, of the patient. And with knowing that, we have been trying to collect some information about the social determinants of health of the patients. We use a pray pair, which is a survey that we include in the new patient packet of every patient, just to kind of get an idea of, what their social environment is like. We're trying to kind of look at some of the root causes of why, we're not helping our patients meet their health goals, and look at some of the barriers to healthcare. Next slide. This BMI screening, documenting BMI, and having a follow-up plan is actually something we're pretty good at. We have BMI screening built into our EMR intentionally. So every patient visit, we're prompted basically to, counsel the patient or provide some kind of preventive services if their BMI is out of range. As you can see, for 2019 and 2020, we exceeded the target goal of 65%. Next slide. And this slide is about tobacco cessation, and it's the same, pretty much the same for tobacco cessation. This is also built into our template. So every patient that it applies to, we counsel the patient about smoking cessation. We did meet the goal in 2019. I think we were a little bit below the target value of 70% in 2020, but we hope to improve on that this year. And I believe that is the last slide. So thank you very much for your attention, and I can take any questions if anyone has any.
Hey, this is Dr. Fleischman. How you doing, Dr. Burks? That's a nice presentation. I wanted to go back to the first slide or two. Did you say you're seeing 75 to 80 patients a week? Mm-hmm. Is that correct? Is that the number that you're seeing?
Yes, that's correct.
Okay, and you're scheduling about how many a week?
Well, our schedule has changed, really. So normally we schedule for 22 patients, but since the pandemic, it's been about, I think, 17 patients. So the scheduling has been a little different. But normally we schedule for 22 patients, but it's been 17 recently. But due to telehealth medicine and a lot of the technical issues and a lot of the extra stuff we have to do to get the patient prepared for the telehealth visit.
Okay, thank you, Dr. Burks.
Mm-hmm.
Any other comments, questions?
Dr. Thru, can you repeat what you mentioned about the wait time Is that approximately 3 to 4 weeks wait time for a new patient appointment?
That's correct.
Okay. Thank you.
Mm-hmm.
Any more questions, comments? Thank you, Dr. Box, very much, and congratulations on the patient-centered medical home.
Thank you.
You're welcome. May I please call on Mrs. Martina Sconia-Talbot to please expatiate on the benchmark 40 and 41 of the public health accreditation training.
Thank you, Madam Chair. Hello, everyone, board members. My name is Martina Sconiers-Talbot, and I am the Administrative Officer 3 at the Health Department. I'm new in this role. This is Ashley's old position. And as you stated, tonight I will be presenting on benchmark 40 and 41.
Thank you.
Benchmark 40 states that the local board of health shall advocate in the community on behalf of public health. And benchmark 41 states that the local board of health shall promote the development of public health partnerships. Activity 40.1 states that the local board of health shall inform elected officials and community boards about community health issues. So documentation for this particular activity would be for elected officials, some type of evidence that shows the board of health informed elected officials about community health issues, as well as the evidence that the board of health informed a community board about community health issues. So one example should be directed to elected officials, and the other example, the other example should be directed towards the community board. And so here you'll see some of the examples that can be used. So one example could be a written correspondence between the health director and a elected official, for example. It could be a memo, a letter, or email. And media articles such as a press release could also be used. Moving on to activity 40.2, which states the local board of health shall communicate support for the enactment and retention of laws and rules in the development of public health interventions that protect health and ensure safety. So documentation here is looking for the board of health communication with support of laws and rules towards elected officials, and since the previous site visit, evidence that demonstrates the Board of Health communicated support for laws and rules on public health interventions to community boards. And as you see, the examples are the same from the last activity. So it could be a letter or memo between the health director or the Board of Health and an elected official. It could also be documentation of an agenda with minutes or a copy of a presentation given by the health director or the Board of Health. Moving on to benchmark 41, activity 41.1 states that the local Board of Health shall take action to foster community input regarding public health issues. And for this documentation, 2 examples are needed. So these 2 examples should be from 2 different public health issues. And these issues could be of any kind of public health topic, such as hazards, diseases, or outbreaks. And we all know that COVID-19 is an outbreak and pandemic, something we've all been dealing with. So that could be used for this activity. An example of that would be notice of a town hall meeting, public hearing, public forum, media article, or a web post. And I just want to point out for this particular activity, the Board of Health should actively be involved in the process. So for example, if there is a public health forum being sponsored by the health department, the Board of Health will need to be present to hear input from the public on this particular issue. Moving on to activity 41.2, it states the local Board of Health shall take action to foster local health department partnership building efforts and staff interactions with the community. Documentation here should be, since the previous site visit, evidence of agency partnership efforts, as well as the Board of Health support of that partnership effort. So this particular activity is looking for 2 pieces of evidence. The first piece of evidence could be an example, where some examples are brochures, flyers, meeting agendas, and news articles, as well as letters of support. And the second piece of evidence should tie back to that first piece of evidence. So for that second piece, it should be Board of Health minutes that are recorded, demonstrating that type of evidence. This example on the other side. So for example, it may be a letter of support, and that letter of support would need to be signed by the Board of Health as well as the Board of Health chair. And it could also be signed by the health director, jointly signed by all 3. Moving on to activity 41.3, it states the local Board of Health shall take action to foster the coordination of resources to enhance partnerships and collaboration to achieve public health objectives. Documentation for this particular activity would be 2 examples of evidence. Evidence for this activity may include the Board of Health members' participation on a community coalition, steering committee, or even an advisory committee. And some pieces of documentation that could be used for this could be a report, an agenda, discussion of Board of Health minutes, or a participant list. I also like to point out that the health director may serve as a designee for the Board of Health regarding this activity. And that concludes my presentation. Are there any questions?
Comments, questions, please? Do I have questions from the Board of Members? Board members?
No, I have none, but I just joined. I'm sorry.
Hello, Mrs. Cancel.
Hello, how you doing?
Wonderful. It's good to hear your voice. My question will be to Dr. Jennifer Green. Where specifically do we need, as the Board of Health, to jump in? Where are we lacking?
So this is one of the benchmarks last year when, you might recall, in November or December, we met with our state consultant or our accreditation consultant, Gay Welsh, to talk about where we were with accreditation and to make sure that we were on target. So these are one of the benchmarks that we've met. And one of the things that Ashley and now Martina and I are trying to do is to flag the things that we need the Board of Health to do as we go throughout the year. So for example, in the December meeting, we asked you for your direction about Travis, our tobacco coordinator, going to the mayor's council meeting. So that's the kind of information and directive that we need from the board on some of these. Is it can't just be the health department or myself saying we're going to go to these community presentations. As Martina said a couple of times, sometimes it needs to be directed by the Board of Health to do those things. So we will continue to flag that information for you when we have opportunities that come up. And if you have anything that you want us to make sure that we're doing, or as the chair or other board members, it would be helpful if you make a formal statement about those in this meeting so that we can get that clear direction in our minutes, and that way it will allow us to use that for accreditation. So we've done a couple of examples of that. You've directed us again to go to the Mayor's Council meeting or the Mayor's Coalition meeting next month. So those types of things help us to make sure that we're meeting that particular accreditation requirement.
Thank you. Can you please keep us posted when you have such programs coming up, so we can send one or two representative to attend from the board.
Yes, ma'am. And one thing I'll add, we are anticipating that to hear back from the accreditation board about the impact of COVID on our accreditation process. So and last year we got a 1-year extension, all health departments did because of COVID. And so we're waiting to hear back about what that looks like for this year. So we'll keep the board updated. We don't have any information yet, but as we hear, we will bring it back to this meeting.
Thank you. I have a question for you. So did we have anybody from the department attend the North Carolina Local Health Department Accreditation webinar was it on January 21?
Yes, so I participate as the health director each month. They have a Wednesday, typically on a Wednesday on the monthly meetings that go to the committee meetings, and then Thursday is the larger meeting. So last month we only had the larger meeting, and I attend those meetings, and so I did attend last Thursday.
Okay. Is it possible that you please give us the feedback at maybe not this meeting, but next meeting?
Yes, ma'am. I can provide a summary of that meeting. I can do that. Yes, ma'am.
Please and thank you. Anybody else have any question? Any comments? Dr. Jennifer Green, while we have you, can you please present the director's report?
Absolutely. So as you can imagine, our world has been COVID. If it wasn't before, it certainly is now. So I'll start with my update as primarily focused on COVID. We in Cumberland County continue to see an increase in cases. We've seen a day or two, maybe 2 or 3 days in a row of decline, and then our numbers will go right back up again. So we haven't yet seen that 14 days of solid decline yet. But one of maybe a little bright spot is that if you look on the left side of your chart, you'll see that in the last 7 days, we've had 1,300 cases, and then the last 14 days, we've had 2,849 cases. And if you do the math, that means we've had fewer cases in the most recent 7 days, just by a little bit, than in the previous 14. So that's just a little bit of a bright spot, perhaps. On average, our daily average of cases, actually these numbers are flipped. Our daily cases per 100,000 are 41.5, and then that number actually is our daily average of cases. Last month when we met was about 66 cases a day. That has doubled. We're closer to 200 cases a day, so my apologies on the error there. But that number has doubled since last month. Our case positivity rate, again, maybe a little bit of bright news, is that our case positivity rate has come down a little bit over the last week or two. We were sitting around 14 or 15, sometimes even 16%. And now, based on the North Carolina data, we're at 12.3% for our case positivity rate. And while we want that number to be closer to 5%, we've seen a little bit of a decline. So that's a positive thing. So related to the case positivity rate, we have our testing data. And this chart shows the number of tests that we have over time, week over week during the pandemic. So again, our target is to test 5% of the population every 30 days. And on the left-hand side, you can see the benchmark or the cut points for how many. I'll note that not this past week ending, but the previous week was actually a high for us. So even though the health department stepped back just for a moment from testing, we still had and maintained our testing levels in Cumberland County. So we had nearly almost 10,000 tests done that week. So, and then I'll also note that because of the day that the data is pulled down on Wednesdays, and so it's the last bar is an incomplete week. And so we actually have, as you can see, quite a few tests, even though our focus has been on vaccines, we still have a number of, a wide array of testing being done in Cumberland. Okay, so now on to the good stuff about COVID vaccine. We have, I think since our last meeting, we shifted the priority guidance at least once since our December meeting. So this is the new prioritization guidance, much more simple than the prioritization guidance that I showed this group in December. I think in December we had a very long, lengthy PowerPoint slide with many words. This is the simplified version and the revised version. So phase one is now, or group one is now healthcare workers and long-term care facility staff and residents. We're currently vaccinating in group one. And then group two is our older adults. And that's anybody age 65 and older. So I'll note that approximately 2 weeks ago, we shifted for that older group to not just include 75 and up, but to include 65 and up as well. Group three is some of our frontline essential workers. The State Health Department has a deeper dive into this section, so we'll know exactly who is in this group three for those frontline essential workers. It's not all essential workers. It is particular groups. Our teachers, our daycare workers, our first responders, all fall into this group three. Some of our other essential workers fall into group four. That might mean some of our other essential workers that have been working throughout the pandemic, but are not what the CDC defines as frontline. And then group four is also where we get to adults with other underlying conditions. So our 64-year-olds that have some other underlying condition would fall in group four. And then phase five is everyone else who may not have had a chance to get vaccinated yet. So on the next slide, and I'll say, said yesterday, the State Health Department launched the Find Your Phase Finder, so you can type in on the State Health Department website some information about yourself, your age, what kind of work you do, if you provide inpatient care or in-person work, then it will help to identify as closely as we possibly can what phase you're in. So we're currently vaccinating in groups 1 and 2. So there are several enrolled providers. We are not the only vaccine provider in Cumberland County. Of course, the health department and Quaker Valley Health System is an enrolled provider. Last week, Goshen Medical enrolled as a provider, and there are actually a few more enrolled providers this week that are coming on board. However, all providers may not have vaccine. There's still a limited supply of COVID vaccine available. And so these three, the health department, the hospital, and Goshen are the ones that are currently receiving some, even minimal allocation of vaccine. Of course, Fort Bragg Department of Public Health and the VA are also partners of our vaccination partners and are vaccinating some of our community members. And then CVS and Walgreens, through their federal partnership, they also provide vaccines to our long-term care facility staff and residents. The State Health Department has a dashboard similar to our COVID-19 data dashboard. They've added a tab for vaccination so we can see by county of residents how many individuals in our community have been vaccinated. I'll make a note about the dashboard that it just reflects county of residents. It doesn't reflect who has done the vaccinating. So in Cumberland, we've done, I don't have a hard number here, but a good number of individuals have been outside of non-county residents. And so it doesn't reflect the number of people that we've actually vaccinated, but the number of people that have been vaccinated. Again, we have that federal partnership with the, there's a federal state partnership or federal private partnership with Walgreens and CVS. And in December, we reached out to those facilities that did not enroll in that federal partnership to make sure that we could get those facilities vaccinated. So we invited those facilities during group 1 to attend our vaccination site, and actually that was it feels like a month ago today when that launched. And so many of those facilities are coming back for their second dose today to get vaccinated on their second round. So we're working on a schedule with them for those that did not enroll and could not come to our vaccination site. So we will go out to those facilities and vaccinate there. And we're currently working on scheduling with them, and then we'll launch that next week for anybody that did not enroll. And it's going to take us a couple of weeks to be able to do that. So on the next slide, we have a little bit about our site plan. So if you have not been out to the Crown to see our site, I'd encourage you, or we're happy if you reach out to schedule a time, and we will walk you through, and so you can see what it looks like in live action. We have decided to use a hybrid model for our vaccination site. And really, we just took every lesson learned from every health department we could possibly think of, took their best practices. As our county manager says, we stole with pride from all the other health departments to see, and hospitals to see what their work was, and tried to put that together in a model. So we have a hybrid model where we do first come, first serve in the morning, and then appointments in the afternoon. And we follow the fit groups as required. So if you are not in the current group, we're going to turn you around and encourage you to come back when it is your turn to be vaccinated. So if you look at the photo on your right-hand side of your screen, we register you outside. So you line up in lanes in your vehicle. We register you outside at your car, except on a day like today when it is very, very rainy, but even in the rain. And then we vaccinate you. We follow the green arrows into the building. You drive your car into the building. We vaccinate you inside, and then we drive you outside of the building into the blue square, where you wait for your either 15-minute or 30-minute period of time, where in that parking lot is observed by an EMT, so we can monitor for any adverse reactions. We do have a walk-in option for very large vehicles. So if you come in a bus or a van that can't fit through the building or fit through our doors, a fire truck, then we're going to bring you around for those large vehicles so we can accommodate them. On the next slide, we have a little bit about why we selected this site. So we were trying, again, kind of looking at what other folks are planning. This model really allows for people to continue to social distance in their vehicle and be separated from others in line, and to make sure everybody is spaced out. And then for the most part, helps us to avoid lines outside of the door. And then it also allows us to operate in varying weather conditions. So for whatever reason, it has rained almost every time we have vaccinated. And we have still been able to forge forward because we can vaccinate inside the building, even though you're in your vehicle. And then on the outside, our staff are bundled up, and we try to keep them out of the rain as much as possible. And then this hybrid model of appointments in the morning, and then first come, first serve in the afternoon really allows us to avoid wasting doses. So if you miss your appointment in the morning, that's okay, because somebody on the first come, first serve line is going to pick up your missed dose in the afternoon. We're going to have to, as we move into smaller and smaller allocations, we're going to adjust that a bit more so that we, the number of first come, first serve that we'll have available will probably be fewer because we're filling up those appointment slots. And then this is on the fast bus route as well. And then today we launched, actually yesterday, on our appointment request form, you can now request assistance for transportation. So once we're able to schedule your appointment, we'll also connect you with transportation services to be able to get out to the crowd. So in terms of how many doses that we received, we have received 2,500 doses of Moderna and 4,875, if my eyes work well, of Pfizer. And as of Saturday, 100% of those doses were off the shelf. So that was the goal that the state health department set, to make sure that by yesterday we had every first dose off the shelf, and we accomplished that. On average, we have done, when we have our first dose clinics, we've done up to 1,300 doses per clinic, driving people through the building, and that's from a 9 a.m. to a 4 p.m. Period of time. Today was our first day when we did a second dose only clinic. So because many of our folks were not actually due for their second dose yet, we did smaller numbers today, but that's because most people aren't due for their second dose yet. We have our allocation for this week is 975 doses of Pfizer. So we have, actually, I did this slide yesterday. So we did receive our doses today. We received our shipment. So we will start those second doses, those first doses tomorrow. Our second doses received, our second dose allocation has matched consistently with our first dose allocation. So take the numbers on the left-hand side and match those to the right, and those are the second dose allocations we have or will receive. And again, most of our second doses are not due until this week, or actually later this week, because we launched our clinics besides staff approximately 1 month ago. So, and then a key to note here is that because we have your second dose that's being held for you, we can't mix and match your first and second dose. So if we have a second dose for you, and somebody comes in and they want that second dose, but if that's for you, we can't use a second dose as a first dose. So on the next slide, this just shows us a little bit about our vaccination schedule. We tweaked this and we may tweak it again, but we typically, starting this week, because of the shipments typically come on Tuesday. We are doing second dose only clinic on Tuesdays. We typically get our second doses the week prior, and our first doses come the week of. So that means that we can't vaccinate the same day we receive the shipment. So we do our second dose clinic on Tuesdays, and then on Wednesdays and Fridays, we will do our first and second doses in the same clinic. And this week we have first doses of Pfizer, but we will not have any first doses of Moderna. And then again, we do appointment slots in the morning. We do a slot time frame because it's very hard to line up cars at 8:15, 8:20, 8:30. So we do appointment slots 9 a.m. to 11, and then 11 to 1, and then flip flop that in the afternoon to first come, first serve. Although depending on the day and the turnout, we can accommodate first come, first serve in our line in the morning, just depending on how that turnout is that day. And I think that is my last slide. So I'll pause there to see what questions you have.
Dr. Green, this is Dr. Fleischman. So I just want to commend you and the team on really good job and great work, and you know, learning from best practices in the School of Hard Knocks. You know, being on the other side of this with the health system and trying to do this and deal with all the changes the state has given us along the way. And Dr. Green has even mentioned that. I mean, as far as how many doses, how they change the game, how they change the criteria, how to adapt to that, how to get a scheduling system for first and second dose with 2 different types of vaccine, and the nuances around that and getting people in. You've done a great job. And so I only think that you all should appreciate that. I can only tell you the health system has gone through this and I think we've delivered, I mean, we've gotten more doses than you all. I think we've delivered about 20,000 doses at this point, with the goal of really giving more. And just like what happened with Dr. Green, we ran out. The state has, their allocations have been, they're waiting for more from the federal government. So I don't want to blame the state fully, because they're trying to do the best they can with what they have, but they've been allocating for other special events. And we're actually ahead of most of the state actually in our vaccination program and the categories we're in. So I think, so great job. Yeah. To be commended.
Thank you. And I should have mentioned, I'm sorry, I should have mentioned, highlighted Cape Fear Valley Health System. Dr. Fleischman's team has done an excellent job as well. I probably talked to somebody on his team at least, I think today, maybe two or three times today already. So we try to make sure that we're in constant communication with the health system so that when they move, we move. As Dr. Fleischman mentioned, there's been changes both at the federal level and the state level. The prioritization groups have changed a couple of times. I think maybe twice since we've met the last time. And so when we are trying to make sure that we're shifting, of course there are challenges when just when you have two types of vaccine and two doses. So it's almost like we have four types of vaccine that we're trying to get out at the same time on different schedules with different storage requirements. So this week will really be I think, the test of our system, because we are going to be doing first and second doses of Pfizer and then first doses of Moderna all in the same clinic in a drive-through. So we're gonna flex our muscles and see how well we can do this week and with that system. So we very much appreciate the partnership with the hospital, and anytime they learn something, they share. Anytime we learn something, we try to share it so that we're both kind of working on the best knowledge that we have.
Dr. Green, this is Dr. Kearney. I had two questions. One was related to how about the wait time? Is it relatively low wait time?
So it varies by day. So today, when we had our second dose clinic, we had times when we had zero wait. You could just drive right up. There are other days in the beginning, the first few days, when we had our staffing. That was when we probably saw in the news we had hours long wait. Now, when we scaled up our staffing and we have this sort of appointment model in the morning and first come, first serve, that really helps speed up the wait time. So it honestly, it varies throughout the day. On Saturday, we also had times where when we vaccinated last Saturday, we had times where we had zero wait. In the morning, as the crowds kind of come in, the wait time I think is a little bit longer. And then depending on the day, sometimes in that afternoon, if you come in at 3 o'clock, you might just drive right in. So, but the risk is that we have doses available. So it really just depends on the day and whether it's a first dose clinic or a second dose clinic.
Very good.
Impressive. I like the.
Another question?
Sorry, go ahead.
I was asking if Dr. Kearney had another question. I thought you.
Yeah. What about in reference to, have you had questions in reference to safety? What is the communication information you're hearing? Can you hear me?
Yes, ma'am.
Yeah. What is the communication and that you're hearing from folks coming to get their injections? Are they feeling pretty positive? Because I know there's been some information in the media that's not been so positive, but on the average, what are you hearing? Or do you feel that populations are moving towards that, yes, they do want to be vaccinated and it's the right way to go?
So we are still hearing some hesitancy, particularly in African American community about getting the vaccine. But I want to encourage people that we know that there's a safe and effective vaccine, and we do take our time when we are out of the vaccination site to explain it. Everybody receives a fact sheet, depending on what they have, either Pfizer or Moderna, and the nurse goes through that fact sheet with you about what the possible side effects are and what is the impact of the vaccine and the effectiveness. And then they also receive we call it a V-Safe flyer. It's an app that the CDC has developed to track any adverse reactions or any side effects that the patient can download or go online and report those symptoms as well. So we have some, I think, mechanisms in place to make people feel safer getting the vaccine. Our nurses are fast, but they're thorough and make sure that you feel comfortable and safe. And so that when people are hesitant, that we answer all of the questions that they have for them, and we absolutely want to make sure that we take the time to do that.
Very good. Glad to hear that.
I was just going to shift a little bit and add a little bit. The numbers you presented earlier about COVID infections and the prevalence in the community, and similar to the drop, I'm grateful to say that you know, the last meeting, I think I had some concerns, and we did see a real spike and surge in hospitalizations. The health system, we went up to almost as many as 130 people in the hospital with COVID-19 at one time, post Thanksgiving and Christmas and New Year's. We've now descended down to approximately 100 people in the hospital currently that have COVID, which is still a big number. Before Thanksgiving, we were in the mid 40s, to give you a perspective.
And that's very consistent, I think, with statewide, that's seeing a little bit of a drop in the hospitalizations as well.
Thanksgiving, and that in the 70s, and then as we approached Christmas and into New Year's, went up to as much as 130. So I just want people to.
Dr. Fashani, you're muted now.
Could you hear me? Could you hear me before, or was I? Did I go out with the connection?
You went out about maybe 10 or 15 seconds ago.
Well, all I said was that we have come down to about 100. We're still very vigilant in watching this. The health system is still significantly strained. We had to expand up to, full isolation units along with our ICU, having a COVID unit along with fifth unit, if you will. We're now, back to a certain degree, but we're still significantly strained at the health system, but we're hopeful to continue.
I'll say I didn't include this in a slide, but we've seen a little bit of an uptick in the number of deaths as well. And that just may be some lagging reporting and timing. But some of the numbers are, good that we're getting at this point. We've had a few days of decline here and there, but we want to make sure that people, even as they're getting vaccinated, are practicing their CW. That doesn't go away.
Hello? Hello? Yeah. I have a question.
Go ahead, sir.
Can you hear me? Good.
Yes, sir. Go ahead.
So, yeah, in North Carolina, do we have what's the degree of a vaccine shortage in North Carolina, in Cumberland County?
I think I heard you say, what is the vaccine shortage?
No. As I said, in Cumberland County, do we have any appreciable vaccine shortage in this county?
So I'd say yes. For example, our capacity a day is to do, the highest we've done is 1,370 or so vaccines in a day. And this week, we're only getting 975 doses. So we can do that in a day. So the amount of vaccine that we have is far less than our capacity to administer the vaccine. And I don't want to speak for the hospital, but I think I can, in that the same is true for the hospital. They receive fewer doses than they have the capacity to administer.
Thank you.
Anybody has any more comments? The drive-through site plan, I believe, is very, very efficient and it's very impressive. Congratulations. I have a question for you, Dr. Green. What is required of the private practices to enroll as a provider, as a vaccine provider?
Yes, so provider enrollment open for private practices January the 11th. And so there is a application that providers can use to enroll. There's some storage, you need to have some storage capacity when you submit your provider enrollment. You have to indicate how you're going to store. And then there are some requirements for how you're going to vaccinate so that you can make sure that you are making it accessible, not just to your patient population only, but some requirements to make sure that you are making it accessible to others in the community, requirements that you're going to follow the groupings that the state health department has requirements that you're going to, your staff are going to complete training as required by the CDC. And then also, I think one of the big requirements is that you'll use the COVID vaccine management system that the state health department has launched. We call it CVMS, and so that is that is our system of record for reporting to the CDC. So that is a requirement, and I think that's probably in the news where you've heard some of the challenges with CVMS. And then there are, of course, the reporting requirements as well, that you'll be able to administer the doses. And our new guidance is that all of those doses that we receive on a weekly basis need to be off our shelves within approximately 7 days of receiving those. So you have to be able to ship, receive, and store and give those out.
Do those private practices have the storage capability?
I think it probably depends. Actually, the hospital, again, thank you to the hospital, they store our Pfizer vaccine for us because we don't have the ultra cold storage capacity. And then, but it doesn't take it doesn't take the ultra cold storage for the Moderna. So that's why in the first couple of weeks, many and most local health departments received Moderna because of that storage capacity, because of that storage requirement. There is the ability to do it on Pfizer on dry ice, but it takes a lot of work, and we didn't even go that route. So it takes a lot of. You do have to have some storage, meet some storage requirements for the vaccine.
So does your vaccine come already pulled up and mixed from Cape Fair?
No, ma'am. So we have a team. One of the things that we learned that makes us more efficient is that we have a team that helps to draw up the vaccine, and then for Pfizer, we have a team that mixes as well. So it comes with mixing kits, but we have a team that kind of draws up the vaccine, and that helps us make sure that we don't waste any.
Awesome. Thank you. Any more questions for Dr. Green? Thank you so much, Dr. Green, for the presentation. That was very insightful.
Thank you.
To the board members, can you please review the attendance roster and communicate any discrepancies to Ms. Kelly? And I now open the floor to board members. Please, comments? Comments from board members, please.
You have already heard most of the comments that I have received as a commissioner, I believe. Well, Dr. Green has received them. Excellent. I don't see how you're keeping up, your department is keeping up with all of the demands. And as Dr. Flashman said, you can't depend on procedures. They change as you implement them. It is amazing. And I have looked at other counties, we've seen on the news, other counties who have not reached a minute percentage of what our county has done. I appreciate what you've done for our citizens and eagerly look forward to completing my personal injections. Not eagerly because I don't like needles, but you know what I mean.
We know what you mean. I thought you were going to say you're eagerly waiting the end of the pandemic, and I was going to say me too.
You're not going to know what to do with your time after that, Dr. Green. You know?
I know. I'm going to go to bed, and I don't know how to use my time. I'm sure we'll fill with everything. I'm sure.
Yeah, I'm going to feel the same way. I can entrust you. I'm going to feel the same way. So.
Thank you, Dr. Council. And Dr. Mamodu, it's good to see or hear your voices again. We missed you in the last two meetings. And thank you.
Let me, please. I have had an unusual family health situation My husband suffers from, Dr. Flashman will have to help me. The heart condition that continues. I hate to say it, but it's about 21 years now. So he had 3 hospitalizations.
I'm sorry.
They were pretty long, so I have been unable to attend the meetings that I should have attended to. What do you call it, Dr. Flashman? Do you remember?
If you're okay with me saying it on this call, I'm willing to try to take a convictor, but I don't want to do that unless you want me to.
Oh, okay. I don't know, but he has a condition that with his heart that cannot be cured. Okay, so we have had a flare up for several months, 5 months, and I have had difficulty, as I did tonight, because I had a late nurse's visit. I'm sorry.
Thank you very much, everybody, for attending today's meeting. Please mark your calendar for the next meeting, February 16 at 6 p.m. And if there's any item that you want us to add to the agenda, please let us know ahead of time. On a final note, I want to encourage us all to listen in to Dr. Green on WIDU 1600 AM radio station. I think it's on Monday, Wednesdays, and Fridays between 8 and 8:30 a.m. Dr. Green, I listened to you on the way to work. The information you provide is very, very educative, very useful, and very upbeat. I was very impressed the first time I heard you on the radio.
Thank you. They're a fun group.
Very good.
Very good. Very educative and very upbeat as well. Thank you all for attending today's meeting, and we'll see you next month, February 16th. Have a great week and be safe.
Thank you.
Thank you.
Thank
Thank
you.
you so much.
Thank you.
Thank you.
Thank
Bye-bye.